Hello, I'm Dr. Alice Villalobos, and since graduating from UC Davis Veterinary School in 1972, I've specialized in caring for pets with cancer and end-of-life care issues as a veterinary oncologist. We question ourselves, is it too soon, or am I waiting too long, or am I causing my pet unnecessary suffering? So what is the quality of life scale all about? Well, I named it the Quality of Life Scale. It's a tool that helps carers and the veterinary team evaluate 7 specific criteria that are needed to humanely and kindly maintain our terminally ill pets at the end of life. So people ask, how do I score my pet on this quality of life scale? Well, the scores range from 0 to 10, 0 being very bad, 10 being ideal. A score below 35 means that the pet has an overall low quality of life, and the goal would be to try to improve the low areas by at least 30 to 50%. The 5 H's stand for hurt, hunger, hydration, hygiene, and happiness. The 2 M's stand for mobility and more good days than bad days. So let's start with hurt. The biggest concern that most of my pet parents have is for their pet to not be in pain. Adequate pain control, including breathing ability, are of top concern. So if breathing ability and pain cannot be adequately controlled, life is no longer worth living for the pet. The second H is for hunger. Evaluating hunger and caloric intake and assuring adequate nutrition is essential to maintaining a good end-of-life program. Is the pet eating enough? When the pet refuses to accept food, and if the carers and the family decline placement of a feeding tube, the quality of life will decline rapidly towards death. So let's discuss hydration. It's essential to know if your pet is dehydrated, because that becomes another disease all on its own that ruins quality of life. Ask your veterinarian to show you how to do the pinch test to determine if your pet may be dehydrated. And dehydration occurs more commonly with diarrhea, poor appetite, not drinking enough water, kidney disease, and so on. If a pet is not drinking enough water, your veterinarian can actually teach you how to give fluids under the skin, and this will supplement the fluid intake and definitely increase quality of life. The 4th H stands for hygiene. Sick animals may soil themselves, and you don't want them to lay around in their waste for hours. It's essential to keep all wounds clean, and we should be brushing our pets and cleaning them often, particularly after they eliminate. We also want to make sure the pet has soft bedding and is turned over frequently so they don't develop sores at their pressure points. The 5th H is very important. It's happiness. The human-animal bond is a treasured relationship that should be maintained during the Pawspice. Does the pet express joy and interest in the environment? Is the pet responsive to family, toys, activities? Or are they depressed, lonely, anxious, bored, or even afraid? If there's no tail wagging and no purring, no happy facial expressions, no snuggling, and no two-way exchange of the human-animal bond and love, then the pet is really enduring a poor quality of life. The first M stands for mobility. Providing care at the end of life can be very demanding, and this is especially demanding when larger dogs lose their mobility. Maybe your dog needs a ramp or a lifting harness to help him get up. But as long as you're committed to meeting your pet's extra needs, you can keep a patient that has poor mobility. But in large and giant breed dogs, lack of mobility is often what we call the tipping point for the decision to help them transition. The second M stands for more good days than bad days. When bad days outnumber good days, a pet's quality of life might be too compromised to continue. Animals do not live in the future. Animals only live in the now. And if that now is filled with continuous pain or suffering, they actually become frustrated. There comes a time when it is inhumane for us to ask a slowly dying pet to go on living. The decision for euthanasia, which means well death, needs to be made if the quality of life is poor and if the treatment the terminal pet is enduring is prolonged. Veterinarians serve the role as Mother Nature's helping hand, and when it's time, it is the most loving gift that you can give, to give a peaceful and painless passage as we lovingly escort our beloved terminal pets over the Rainbow Bridge.